Hello and welcome to this Sunkids educational and training video discussing the topic of hand hygiene. Hand hygiene is the general term that refers to washing your hands with soap and water or using an alcohol-based hand rub to effectively clean them. Hand hygiene is one of the most simple and effective ways to break the chain of infection and is the most significant way to reduce the spread of contagious diseases and minimise cross-infection. The most effective method of hand hygiene is using soap and water. This is the best option when your hands are visibly dirty. Washing your hands with soap and running water loosens, dilutes, and flushes off dirt and germs, leaving your hands hygienically clean. Effective hand drying is just as important as thorough hand washing. Damp hands pick up and transfer up to 1,000 times more bacteria than dry hands. Drying your hands thoroughly also helps remove any germs that may not have been rinsed off. Using paper towel is the most hygienic hand drying method. It is important to remember that soap and water are the best option when your hands are visibly dirty. However, alcohol-based hand rubs can be a fast and effective way to reduce the amount of germs when performing tasks in which hands can potentially become contaminated and soap and water are not available. Alcohol-based hand rubs are safe to use as directed, but children may be at risk if they consume the hand cleaner, inhale it, or splash it into their eyes or mouth. Alcohol-based hand rubs should be kept out of reach of children and only used with adult supervision. Germs are most commonly spread through contaminated hands. As a general rule, hand hygiene practices should be performed before you touch anything that should stay clean, such as before eating or preparing food, and after touching anything that might contaminate your hands, such as using the toilet or wiping a child's nose. All staff, students, volunteers, and children should wash their hands at the following times. On arrival at the service, alternatively, antibacterial hand gel may be used, before and after eating or feeding a child, before and after handling food, before and after giving medication and providing medical procedures or first aid, before and after changing a nappy, after using the toilet or helping a child use a toilet, after cleaning up blood, feces or vomit, after wiping a nose, after touching pets and other animals, after playing outside, before and after using gloves and when changing gloves, after cleaning, gardening and handling garbage, before going home, alternatively, antibacterial gel may be used. The process of thoroughly washing, rinsing and drying your hands or a child's hands should take around 30 seconds. There are 5 steps to washing hands. Wet hands with running water, preferably warm water for comfort. Apply soap to hands. Lather soap and rub hands thoroughly, including the wrists, the palms, between the fingers, under the thumbs and under the nails. Ensure you clean beneath any rings or jewellery on your hands by moving the jewellery around as you lather the soap. Rub hands together for at least 15 seconds or for about as long as it takes to sing happy birthday once. Rinse thoroughly under running water. Dry thoroughly. Babies need their hands washed as often and as thoroughly as older children. If the child is unable to stand at the hand basin, wash their hands either using a clean baby wipe or a pre-moistened hand washer and then pat dry with a paper towel. Once the child's hands are clean, place the used hand washer into a soaking bucket to be laundered. Only use alcohol-based hand rub if your hands are not visibly dirty and you do not have immediate access to soap and water. To provide suitable sanitation, the hand rub should contain 60 to 80% alcohol. There are 3 steps to using alcohol-based hand rub. Apply the amount of hand rub recommended by the manufacturer to the palms of dry hands. Rub hands together, making sure you cover in between fingers and thumbs and under nails. Rub until hands are dry. Thank you for your time today. We hope you enjoyed this instructional video.